Hello, everyone. My name is Dr. Richard Horowitz, and I'm co-host of the Healing Lyme Summit. And I'm here today with my other co-host, Mariah Hinchy, who's a naturopath in Connecticut. Mariah, thank you so much for joining us today. The topic of our talk today is what not to do when you get Lyme disease. So I'm just going to read a quick bio for Mariah, and then please tell the audience a little bit about yourself. So Dr. Mariah Hinchy is a Connecticut-based licensed naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs, or MAPS, specializing in the treatment of vector-borne diseases. She has over 17 years experience, has treated thousands of patients facing chronic tick-borne diseases, giving invaluable insights into the complexities associated with these conditions. So, Mariah, thank you so much for joining us today. Why don't you tell the audience a little bit about yourself and how you got into this?
Sure. Hi, everyone. Happy to be here. Thank you for having me. Well, I was kind of forced into this, right, as a doctor who treats the underlying causes of chronic disease. And I specialize in treating both adults and children with tick-borne disease. I'm a naturopathic doctor in Hebron, Connecticut. And, just from really, 17 years of treating patients and then myself ending up with several tick-borne diseases and going through that journey. I feel like I've learned a lot, and I've learned how to apply this to my patients as well as my family, focusing on lifestyle medicine, nutrition, as well as using herbal medicine.
And I think the important point for people out there listening is, because I've worked with naturopaths and I think they're an invaluable resource, right? So that if a doctor has not really been trained in functional medicine and understands this, working with a naturopathic physician could actually be invaluable, right? When you're dealing with these illnesses, because the naturopaths look at the terrain of the body, they understand herbal medicine, some of these lifestyle changes, as you said. So personally, I have worked with several of them, and I found them actually to be invaluable in our practice and really made a big difference in supporting our patients' health. So I think it was a great choice of careers, and you're certainly in the right place at the right time in Connecticut during this tick-borne epidemic, right? So great. So let's dive in to this conversation today about what not to do when you get Lyme disease. And this is an important topic because there are people, I think they don't understand, right, the do's and the don'ts of this disease. So let's start off with one of the most important things you should not do, which is why should you not take steroids like high-dose prednisone? Should you take immunosuppressant drugs if you have, for example, a very bad case of rheumatoid arthritis and you have to be on them? Like, what is the problem with using these?
So the problem with using these is that really how they work is shutting off the immune system. So if you have an infection and you need your immune system to fight this infection, taking something to suppress it is going to allow this infection to proliferate, which is get bigger and spread throughout the body. And so the temporary relief that you might have from pain and symptoms while you're on the steroid is not going to, that benefit does not outweigh the risk of allowing this infection to get bigger. Now, obviously, if there is a life-threatening situation, right, where there is no other option, then we need to pay attention to that. And really, that brings up the point that everything that we do in medicine should be individualized. There isn't a one-size-fit-all answer, but I would say as a rule, let's say you have Lyme and you get poison ivy. Should you go on prednisone to manage your poison ivy? No, you tough out the poison ivy, right? If you're on some sort of immunosuppressive drug because you have an autoimmune disease. And so, talking about chronic Lyme disease, this has happened a myriad of times. I can't tell you how many patients come in on a biologic on some sort of immunosuppressive to deal with their X, Y, or Z autoimmune disease. And really, how this goes with me, right or wrong, is that I say, look, to me, your autoimmune disease is a symptom of these infections. And when we get to the end of treatment, and so I was always taught that a patient should be treated until they have been symptom-free for at least 2 solid months, right? Then you go back and you do your reevaluation. So if we get to that point with a patient who's on some sort of immunosuppressant drug, then hopefully with the blessing of the doctor that prescribed it, they then get off that drug because they've been symptom free. And then we still have to wait. We have to wait and see how the body responds, because the person might flare, the person might relapse, because that drug was sort of like managing part of the symptoms. In my opinion, in the end of this, and I'm saying this very carefully, there's no prescriptive or herbal antibiotic that is going to take this infection to zero. Okay. It's going to shrink the load, but it's the immune system that has to come in the end and force it into remission, right? You're going to usually have those few little stragglers hanging around. So if you're on something that is suppressing the immune system and you stop taking your antibiotics, it is likely that that infection is going to return.
No, it's a great point. You brought up an important point. I mean, there are life-threatening situations where people have to use steroids. I mean, the only time, by the way, with poison ivy I've ever had to use it is when it started getting into the face and into the eyes. I will use a Medrol dose pack, and occasionally a pulmonologist will put someone on a Medrol dose pack for horrible asthma, right? I mean, sometimes there is no choice, but I have seen people relapse on steroids. The reason you and I both avoid them like the plague is I have seen people relapse, and the autoimmune drugs like etanercept, which they use for rheumatoid arthritis, a TNF alpha inhibitor, it's been shown that Borrelia burgdorferi will relapse, right? It will come out with these type of drugs. So I will usually kind of bargain with the rheumatologist to see if we can get them off this drug, right? Use methotrexate, use something else, but something that's not maybe going to, sometimes they absolutely do have to have these drugs. I deal with a couple of autoimmune cases this way, but you're right. If you can avoid it, you absolutely want to avoid steroids. And it also can cause reactivation of Babesia, which can be life-threatening, right? So people need to know, yes, it's personalized, exactly what you said. It's not one size fits all. You've got to look at the individual case. But in general, steroids is one of those things you want to try and avoid. And you're right. I tell my patients to tough it out with poison ivy as best they can, unless it's a very severe case.
Something else quickly to point out, because you brought it up. So TNF alpha, we can inhibit that using Chinese skullcap and red sage.
Right. Second question. Some people exercise very aggressively, right, when they have this disease. What's the pros and cons? Why shouldn't you maybe overdo it sometimes when you have Lyme disease?
Right. So, I want to say there's a lot of benefits to exercise, but I'll call it gentle movement therapy. That's what I call it with my patients, right? We want to get the blood circulating. We want to get the lymphatics moving, which you can't really do without pumping your muscles. And it's good for our well-being, right? There's multiple benefits, but I always tell people we do not want to be pounding the pavement. We don't want to be putting excess stress on our joints, on our tendons, on our ligaments when they are inflamed, right? With an infection, because the nature of, for example, just the spirochetes is to eat collagen. That's how they live. So a strand of collagen has the exact nutrient profile that they need to survive. And when they release inflammation and break it down, that collagen is not, or that degrading of the collagen is not only going to cause more inflammation, but it's going to make joints potentially less stable and more prone to injury. So I like patients to do things that they're not pounding, right? Then take it a step further. If you are really aggressively exercising, that's actually a stress on your adrenals. And so you can actually have a very negative impact on your hypothalamic, anterior pituitary adrenal axis, and cause a lot of like adrenal fatigue, adrenal burnout, but also end up suppressing your immune system.
Right. Great points. And by the way, I've seen this happen. I've had patients who have over-exercised with Lyme, for example, people that weightlift, and I've seen them rip tendons. You have to be very, very careful because the tendon insertions, as you talked about, can get inflamed. You do not want to overdo it. And for exactly the same reason with the adrenals, I've seen people crash because they have adrenal fatigue. And all of a sudden, for example, they'll take dapsone combination therapy. They're feeling much better. And then they think, I'm going to go out and do a 5-mile run, right? And they've not prepared for it. And then they're in bed for a week because they crashed their adrenals. So I think those 2 points you brought up are actually the most important ones that I see in my practice is the adrenals and the inflammation in the joints and in the tendons, where I have seen people damage themselves, right, from doing it. So those are really excellent points. And what about the role of diet? I mean, what about any diet when you have chronic Lyme disease, what you should and should not be eating, right? If you have someone with chronic Lyme disease.
Well, this could be a whole weekend summit. No, so I say, try to keep it simple. Eliminate all of the things that cause inflammation because inflammation is going to make your symptoms worse and feed the infection. So to me, that means no gluten, no dairy, no sugar. Okay. Then to take it a step further, I think that patients should have their food sensitivities, their IgAs and IgGs looked at, because if you're eating something that is causing your immune system to overreact, or you're just simply using immune resources to fight the food that you're putting into your body, then you're draining part of your immune reserve. And we only have so much. And, in our environment, both internal and external, we have very, very little control over what we are exposed to. The one thing that you do have control over is what you put in your mouth. So knowing, what foods are acting as medicine and what foods are acting as poison, because ironically, I've had to tell people don't eat broccoli or onions before, right? So something that I would never dream to tell a patient not to eat, this particular patient, because they have really high antibodies to it, I have to tell them to avoid it, right? So that's kind of my elimination part. And then my focus is on eating a phytonutrient rich, low inflammatory diet. That includes, to me, I'm all about quality. So grass-fed beef, organic chicken, wild fish, right? So the quality of the food to me is really what is important, right? So that we're not putting more toxins into our food. I try to get patients to eat organic as much as possible, again, to avoid toxins, but also some of the growing techniques with organic food can increase the nutrient content in that food. And I really try to get patients to kind of avoid nightshades, avoid a lot of legumes, because of the lectins, which can be damaging to the gut. And I mean, anyone who's heard me lecture before knows how crazy I get about the gut and the state of the gut health and intestinal permeability, because when we have a leaky gut, we can't detoxify. And if we can't detoxify, we are going to herx like crazy. And that's going to drive the inflammation and oxidative stress and cell damage and make the state of the body worse, not to mention make all of the symptoms worse. Um, I love intermittent fasting. I think it is a great tool. Obviously we have to exercise caution. People that have adrenal issues are not great candidates for doing intermittent fasting, but I really do believe in, as long as you're giving the body everything that it needs to function properly, in having these extended periods of rest, because we do have this really strong innate ability to, clean and repair and regenerate and rebuild ourselves. Sometimes we just need to get out of the way.
Yeah, no, you're bringing up important points, and let me summarize again, and because people, the listeners, really
Because
need to
I go
hear.
on and on.
Well, no, you brought up extremely important points. So let's go back and talk about what you just said and why it's so important. The gut is number one. Two of the inflammatory factors on the MSIDS map, there's 6 out of 16 factors in the MSIDS map that are inflammatory. Two of them are the gut, the wrong types of bacteria in the gut. You've got too much Clostridium, Prevotella species, not enough Akkermansia species. Very important. It drives inflammation. They've associated this with Alzheimer's, with Parkinson's, with MS, right? Depending bacteria. But the leaky gut component, most people don't even know what leaky gut is. I'm finding it in almost every patient now that we test. We do a 95 IgG food panels to LabCorp, or sometimes we'll use doctor's data or the specialized labs. And we're finding all these people that basically have hyperpermeable guts. And the reason you don't want to eat anything at all and follow this diet is because it drives the same inflammatory profile you get with Lyme. So if you're eating the wrong foods, you don't want to have the same fire in your body that you're getting from Lyme. It's like pouring gasoline on it, right? Not to mention SIBO, small intestinal bacterial overgrowth, that shows up in some of these people. And at least in my population, there's a large amount of them that have metabolic syndrome that, have to be on like a paleo Mediterranean, similar to the autoimmune diet you're talking about, the paleo Mediterranean style diet with lots of good phytonutrients, eating organic with berries. And my wife this morning, we were having our yogurt with a bunch of organic berries, right? And I had my almond butter with, a small piece of organic bread. I mean, that's what we do, because if I don't stabilize my blood sugar by 2 o'clock in the afternoon, I'm tired and I get a headache and I feel shaky and I feel dizzy. And those are symptoms you can get with Lyme disease. So the diet is absolutely crucial. But you're right, it's got to be really looked at in detail, especially because even mast cell disorder, right, can happen from Lyme, it can happen from mold, but it happens in the gut from eating these wrong foods. So really important points that you brought up about this. So yes, thank you. What about Dr. Google? What do you think about people going on the internet and coming into your medical office and saying, I have an answer and I think this is it. What do you think, doctor? How do you respond to these patients when they come in and they're playing Dr. Google?
I just get up and leave. No, I'm kidding. So Dr. Google is not Lyme literate, guys. Yeah. Well, here's what I tell people. When you find somebody that you have a good rapport with, and most of these Lyme patients have done their work, they don't just stumble upon a good Lyme doctor. It's almost like they have PTSD. I mean, for real. And so a lot of times we have to go through this whole like, okay, look, I've got you. Please stop searching. Like, because it's like three full-time jobs, the amount of research and searching you're doing. And I want my patients to be knowledgeable, and I am probably at fault for over educating my patients. But I tell them, as long as it made sense, just let it go. Like, I want the mind-body connection. I want your brain to hear it so that you have that mind-body connection to the treatment. But additionally, like, education is key to be able to stay in this marathon of treatment, right? So like, they have to understand why they're doing what they're being asked to do, or they're not going to do it. But that being said, I ask patients to please trust their doctors if they feel like they found someone that knows what they're doing, and put all of that extra time into doing things that are going to calm their nervous system and nourish their body. So whether that's visualization, deep breathing exercises, massage, walking in nature, as long as they're not getting bit, things like that. And just kind of like let all that other stuff go. I mean, if there's some new research that they stumble across, of course, bring it up to their doctor. If they're having red flags that their treatment isn't working, of course, bring that up. I think chat groups can be some of the most helpful. I can't tell you how many patients figured out that they had a tick-borne disease in a chat room, which is great. Like, the chat room served its purpose because they identified with symptoms that somebody else had. But a lot of these are toxic. Like, they become places that are just doom and gloom and complaining. And it's like, your mindset matters. I can't emphasize that enough. And so, I think that once you have your own little sort of community of support, like real people and your doctor, it's best to kind of stay off of the internet and stay out of these Facebook groups and chat groups. Because to me, they can be toxic.
No, I agree with you. And one of the points you brought up, I mean, also, by the way, I have some brilliant patients. One of them specifically, she sends me articles all the time and says, did you see this? Did you see that? And the truth is, sometimes I have not seen the articles. Yesterday, she sent me one on beta glucan and its effect not only immunity, but on cognitive functioning, that it improved people with fibromyalgia and chronic fatigue. It's like, oh, how fascinating. I didn't know that. I take it every day, beta glucan, for my natural killer cells. I didn't know I was so. But you're correct. And I actually have a sign in my office that Dr. Google did not get a medical degree, but I did. So I remind them that there's a lot of stuff out there. It's the Wild West. And you bring up a really important point about the chat groups, about the doom and gloom. Ever since I personally have discovered dapsone therapy, and we're getting so many people better, I don't feel it's appropriate anymore. I never wanted to give people false hope. But there's no reason for false hope at this point. There actually is true hope, because with all of the things that you and I are discussing, people can get better. And it's fine to have a group that understands you and is empathetic and compassionate. We all need that. but not just where everyone's complaining and you're kind of feeding on one another with negative emotions where it can be highlighted. It's true. That's not good for your mental or physical health. So yeah, it's a great point. So what not to do when you get Lyme? How do you feel about surgery? What should people do to prepare for surgery? And what about vaccinations? Because of course, this is a big one at this point, because obviously people need them to protect themselves, but some people do get worse, right, with some of these vaccinations. How do you deal with this with your patients?
Well, I deal with it again. I think the key thing is on an individual basis. So neither of these topics are a one size fits all. And I think you have to go through and you have to weigh the risk versus the benefit. So starting with surgery, it depends. If it's elective, I always say put it off. Cutting into the body, you are physically inducing inflammation and an immune response, right? And so going back to me, the two foundational things that this infection is going to feed off of, right, is a dysfunctioning immune system and inflammation. So I highly suggest that we do not do any surgeries that are not needed. We put them off. And I can't tell you how many times I've had a patient actually have, so like, for example, if it is a tendon that has like a small tear, right, where they could have surgery or maybe not have surgery, and then they go through the whole treatment, and then lo and behold, by the end of the treatment, they no longer need the surgery. Like they're not even having pain in that joint anymore. So, my point is like, my point actually wasn't that it might not be necessary, but my point is we don't want to cause undue inflammation into the body. So obviously, if there is a life-threatening surgery or a surgery that needs to be done, I always defer to the doctor performing the surgery and the anesthesiologist as far as, what supplements, what medications, like what can you stay on and what do you need to come off of, because your life is in their hands. So that is something that I'm always deferring back to the surgeon for. As far as vaccinations go, obviously it's a very, very controversial subject. I always try to come from, again, an individualized perspective, but I also very much come from, and this is sort of like in my whole life, like doing no harm. So like, actively going out and doing something that might then pose a repercussion, right? If not doing anything doesn't pose that same repercussion, then I'm always going to err on the not doing anything, right? And I'm dancing around this subject right now, but I just don't really think it's wise to be putting extra toxins and things, adjuvants that are going to drive up the immune system when you're already dealing with a chronic inflammatory infection. But again, I'll go back to, this is a person by person by person choice, and you really need to risk or to weigh the benefit of that vaccination versus the risk of not getting it. And if there are known risks of getting it, with the benefit of what it will do.
Right. No, these are excellent points. And you're right, it's personalized. And, I'll just bring up one or two points about the surgery and the vaccines. Probably the most common surgeries people go for, and I do tell them, by the way, I have a couple of women that wanted to do cosmetic surgeries, and I basically said, please put it off. And one of them just went through her second pulse of dapsone combination therapy, the 2-week pulse after doing the first 9 weeks. And she just told me, I just heard from her the day before, she is way better. In other words, her fatigue is better, her headaches, even her POTS dysautonomia, it's way better controlled. And she's in a much better state now to go through the surgery because she wanted some cosmetics done. And I just told her to please hold off until she was in a better state. But I make sure that people's immune systems, are intact, but also their adrenals. We talked about this earlier. If you go into surgery and your adrenals are low, you're going to have a big problem from it. And I've seen this happen with certain patients. The second thing is with joint replacements. A lot of my patients who've been sick with chronic Lyme for decades, they're all going for joint replacements, shoulders, knees, hips. And there was a point we know that Lyme in these co-infections can degrade the bones. And I don't think people have realized this enough, that one of the dangers of these chronic tick-borne infections is you may actually end up with a severe case of osteoarthritis needing replacements. And I'm starting to look now at my practice. I've been doing this close to 40 years, and I'm realizing the people that have never taken either these persister drug regimens like dapsone or disulfiram, or have not done aggressive enough therapy, whether it's herbs or antibiotics, many of these are going for joint replacements. And I mentioned to them, if you have not gotten rid of these spirochetes completely, you're going to have a biofilm start to form on your joint replacements. So I'm going to want you on biofilm agents literally for the rest of your life, whether it is a breast implant or whether it is even dental implants or whether it is a joint. You've got to stay on these biofilm agents. So those are the only things I'll probably highlight for patients in advance, is the need to be careful with the biofilms when you're putting an external surface in your body and to make sure your adrenals and your immune system, are in good shape. And as you said, not to just do surgeries when it's absolutely not necessary. The vaccine issue.
Can I interrupt you for one
Oh,
second?
yeah, of course.
So I would also say, so the thing that worries me, especially with cosmetic surgery, right? Or say you're getting a facelift or something like that. So, I mean, we know, right, that tick-borne disease is notorious for causing poor wound healing, right? And for things not to heal properly. So oh my goodness, why would you want, right, to have any sort of cosmetic surgery done where you're worried about how it might heal, when you have an infection that's going to impair your ability to heal correctly. And I was always taught that Lyme goes to places of injury, like a magnet, right? So if you've cut into yourself, right, the Lyme's going to actually want to go there because it's like a free buffet, right? So I would be scared to death to have cosmetic surgery while infected with any of these organisms.
No, it's a great point. It's kind of Las Vegas. It's a free buffet, right?
Yeah.
You eventually lose. You eventually lose most of the time, but you do get the free buffet at least for a while. Yes. The only other thing I would mention about the vaccines, because I was in a controversial position as a board certified internist when COVID came out and the vaccines were released. And I waited a little bit to decide on the safety of the vaccines. And I decided early on, after I looked at the literature, that people were dying from the initial, alpha forms and delta forms of the virus, that it made sense to get vaccinated. And I did, and my wife did. And it was very interesting in the Lyme community to see the amount of negative press I got from people of how dare you tell the Lyme community to get vaccines for COVID. And ultimately, Dan Cameron did a study, and he and I was discussing this at some point on webinars. We looked at over 800 people in the Lyme community who took the COVID vaccine. There was no worsening of symptoms. And in fact, it helped some of these patients prevent them from getting sick. So I think it's on a case-by-case basis. So for example, pneumococcal vaccines, there's nothing live in it, right? I don't have to worry about it. Diphtheria, tetanus, there's nothing specifically live in it. The COVID vaccine, I mean, it's been problematic for people in my practice because some of them who've gotten boosters have reactivated with their Lyme after dapsone. It's not happened a lot to me, but I've seen it happen a couple of cases. But the problem, at least that I face with it, I'm not an anti-vaxxer. I've been to India 8 times. I've been vaccinated for everything under the sun. But I'm also careful, as you are, in these people with overstimulated immune systems. And really what I ask them is, how have you responded to these vaccines in the past? Have you flared? Have you relapsed? Have you had a problem with it? One of the case studies I'm writing up now for one of the journals who's had Lyme and Bart, she's had 7 boosters for COVID-19. And she's in full, by the way, she got COVID 7 times. 7 times. And she's done dapsone. I think she had 5 or 6 pulses. She is 1 year in full remission, got COVID-19 7 times, and was boosted, I think, 7 or 8 times, and was fine with each of them. But if you ask other people how they fared with these vaccines, it is completely individualized. The one thing I will tell people, because it's individual, because obviously I'm here to save lives and I will follow a middle path. When people do take the vaccine, specifically the COVID-19 boosters, and this is what I did when I got vaccinated, I tell them to take 2 grams of glutathione within 15 minutes of the vaccine and several hours later. Why? Well, in part because when they were talking about getting the messenger RNA into the cells, they were using something that was fat soluble, right? That in some people, right, would maybe cause a problem with this overstimulated immune system. And glutathione is one of the things that blocks NF-kappa B that we've talked about earlier. Whether it has made a difference or not, I can't tell you specifically, but it seems like maybe it's made it easier for some people by kind of stopping that NF-kappa B activation with N-acetylcysteine and alpha lipoic acid and GLUT. But you're right. I mean, people in general have responded in all different ways. But I will point out for the Lyme community that you should read Dan Cameron's study because many people are scared about it. They're scared about the spike proteins. There's a lot of things I think we don't know at this point. There's still unanswered questions, but people are still dying. We need to have some protection. I personally, I take beta glucan every day. I take glutathione, which has been helpful for viruses. We both got COVID, I would say probably 3 or 4 months ago when we were coming out of Cape May, New Jersey. And, we took Paxlovid and we took all the supplements on our website and we were fine. But it is true. It is a very controversial subject, and it's something that people need to know. But at least for the Lyme community, since we're talking about it, they should read the Dan Cameron study because I think it will allay some of the fears about getting vaccinated, understanding that still there are some people that will have an overstimulated immune system with these boosters. But I just wanted to point that out, that it's not so black and white, and we at least have one study, at least on the COVID vaccinations in people. Let me talk about the next subject as far as some of these patients who come to you on long-term antibiotics. Do you see the complications sometimes? Do you see these people? The IDSA is always talking about long-term antibiotics are dangerous. People get, Clostridium difficile infections, or you can see a candida overgrowth. How often do you see this, and how do you treat these people or prevent it from happening? Like, what should they do to try and prevent it?
Yeah. So just to give a little bit of background, like for the first, I don't know, 6 or 7 years that I was involved, in treating Lyme disease, you know, basically I was referring out to Lyme literate doctors, and these patients were on combinations of antibiotics for a very long time, at least a year, if not 2 years, 3 years, right? And I was doing the naturopathic doctor thing, trying to keep them as healthy as they could be while on them. I think every Lyme literate doctor out there knows the importance of using Saccharomyces boulardii to prevent Clostridia overgrowth, C. diff, and, as well as the importance of other probiotics, right? So yes, I have seen C. diff now in 17 years, probably, as many times as I can count on one hand, literally. And so, no, I've not seen a big issue with it. But then fast forward, I did another 5 years where we were doing integrative treatment. So I had several doctors who were handling the prescribing of antibiotics while I was doing actually the herbal protocols and all the lifestyle stuff, naturopathic stuff, detox, et cetera. And again, during that period, I don't think I mean, maybe one person with C. diff. So no, but again, the proper precautions were taken to prevent the C. diff, in my opinion. Okay. Candida, yeah, I've seen quite a bit of candida overgrowth, but I gotta say, it's not just in these Lyme patients that have been on years and years of antibiotics. I mean, there's a lot of people in the general population running around with Candida albicans and other fungal family, organisms as well. So, I think here's what I think. I think that having chronic tick-borne disease devastates your body and ruins your quality of life, and you need to do something about it, or you're gonna end up with cognitive dysfunction, autoimmune, neurological issues, et cetera, and you're not gonna live an optimal quality of life, okay? Whether doing combinations of antibiotics are right for you, or whether doing, herbal medicines are right for you, or whether doing a combination is right for you. As long as you approach it with somebody who knows what they're doing and somebody who knows what not to do, and you do it right, that's what matters.
Right. And you bring up some important points. And again, want to stress for people who, let's say, are working with a board certified internist like myself, the beauty of working with somebody like Dr. Mariah Hinchy, who's a naturopath, is the doctors don't always have the time to be able to go through the herbal therapies and the lifestyle therapies and your diet in detail. And that's really the great point of having a co-pilot right along with you. I mean, Mariah and I are both co-hosts of this Doctor Summit for a reason. And that's because we're coming at this from, complementary approaches. We're both doing this trying to get the patients better. And we have complementary approaches of how we do it. But I agreed with you in the studies that I published on dapsone, we have people on over 400 to 500 billion of these good, colony forming units of using Saccharomyces boulardii, using the orthomolecular orthobiotic, using Theralac from Master Supplements, using the Probiomax 350 billion from Zymogen. I mix and match these probiotics. We have not seen a case of C. diff in a really long time. So when some of these members of the IDSA are saying, these long-term antibiotics will kill you, well, yes, of course, without the proper microbiome support, you're going to risk C. diff. And by the way, there's 500,000 cases of C. diff in the US every year, and it's not happening from Lyme doctors. It's happening in nursing homes. It's happening with pediatric doctors who they give 10 days of antibiotics and they don't give them probiotics. So it's a great point, right? The part about Candida, by the way, you're right. It's common. I had it. My stepfather was a surgeon. I was given antibiotics as a kid. I never took probiotics. I didn't even know what they were. And when I got older, I realized that some of my hypoglycemic symptoms were due to Candida. And I had to clean out the Candida out of my gut. And I have to be careful when, sometimes, I generally maintain a great lifestyle, but, I'm Jewish and I nosh a little bit at night. And the noshing gene is just part of my genetics. So I have to be careful. I take vows every once in a while to just cut back and make sure my carb load is all the way down, but it's a problem with the general public. You're right. I see a lot of Candida. In fact, when people stop the antibiotics, like dapsone is only a 9-week oral antibiotic protocol. It's not long with 2-week pulses. So that's the beauty, of course, is it's not long term. But anyone can get a Candida overgrowth, even taking a week of antibiotics. So that's the reason these biofilm agents we use, biocidin, cinnamon clove oregano oil, pepper. They also have anti-candida properties, antifungal properties, right? So there's a lot of advantages of this integrative kind of functional medicine naturopathic approach as far as keeping down the side effects of it. And we don't really see a lot of cases unless people are really off their diets.
Yeah. And a lot of times too, so I love grapefruit seed extract because it's antifungal, but then also there was a study or two that showed that it agitated the round body or the cyst form of the spirochete. And so, it can be kind of used as an anti-cyst agent as well. So you get the dual benefit of that there.
That's a good point. And we use it. We use grapefruit seed extract all the time. It was Dr. Brorson from Norway.
Okay.
He's the one who actually talked about it, apart from Plaquenil or flagyl-tinidazole being that. So yeah, it's a great point. So one last question before we finish this up for this section on what not to do when you have Lyme. Patients out there, they'll come into you and they're doing IV ozone, or they're doing Rife machines, or they're doing hyperbaric, or they're doing lots of herbals. There's a lot of things out there. Peptide therapies, which, by the way, have now been outlawed. Tell me a little bit about what your experience is with these. How helpful are they? Side effects, when do you recommend them? What do you think about some of these therapies?
Sure. So, they're not standalone therapies. And I think that that's probably the biggest point to make, in my opinion. Okay. I think that these are adjunctive therapies that can be used to help to most of them. It boils down to modulating the immune system and decreasing inflammation, right? So they are things that can be used to maybe speed along the process or to alleviate symptoms. I love hyperbaric oxygen therapy, excuse me, because it can help to actually deal with areas in the brain that are under oxygenated. So it can actually help to increase blood flow and oxygen to the brain. Hyperbaric oxygen also is useful to detox. These tick-borne diseases don't like oxygen. So if you can supersaturate the bloodstream and the tissues the bloodstream and therefore the tissues, where these infections like to live with extra oxygen, it says that there can actually be a little bit of antimicrobial effect. It's also anti-inflammatory, which can help to relieve symptoms as well as, I believe that inflammation drives the infection. So, I love HBOT. I love using far infrared sauna because it aids in detoxification in general, but also at a cellular level. I personally don't use a lot of pulsed electromagnetic field. However, I've learned a lot about it at the summit, and it's something that I actually plan to bring into my practice. Ozone can be helpful, Rife can be helpful. Again, like there's so many really great therapies, but again, I think that they should be used in conjunction with a solid core protocol. And you got to commit to it. You can't just go do like one rifing session or one hyperbaric oxygen treatment. You have to really like put in the time and look at, if something has been studied, what was the number of hours of that therapy and in what time? Like, so for HBOT, it's typically about 30 to 40 hours in a month, right? So it's like you need to know what the requirements are to get the desired outcomes of any of these therapies that you're going to use. And then they can be very helpful.
Right. And there are also people, I mean, I agree with you. And sometimes the hyperbaric can be helpful, especially with brain traumas, right, and concussions and people that have cognitive issues. The only place and I haven't seen a lot of it. The only thing I ever concerned about, there have been studies where maybe with Babesia, there may be some reactivations in some of these patients, but I've never really seen a lot of good studies on it. It's just something I kind of watch for. What about these patients that do the low dose hyperbaric, these people that actually buy these units themselves? Do you have any of your patients who've done that? Do you see therapies like that work?
Yeah, actually a multitude. So like these soft chambers typically are at 1.3 atmosphere. So it's not like going, to the hospital or having one of these hard chambers. However, most of the studies where they've looked at before and after SPECT scans, and this is where I'm referring to like the 40 hours and 30 days, like where they can see the changes in hypoxia, they were actually done on with these soft chamber units. So I am actually part of the International Hyperbaric Association. I have an HBOT in my office. So I do see differences from these, and the studies that I have seen were actually done on some of these lower atmosphere units. I wouldn't go under the 1.3 though.
Right. So that's good to know. So safety wise, you've not seen problems and you have seen some benefits of it where you've not seen any problems really with people using them.
Yeah, and to be clear, I have never referred anyone for the hard chamber, so I personally have zero experience in doing that much higher atmosphere treatment. And that, I mean, my understanding is with those, that's where you can have, more side effects.
Right. Although, the problem, of course, with Lyme is there's only some very limited studies that were done years ago, right, in Texas on some of these. The thing about ozone, these oxidative stress therapies, I mean, there clearly are people that get some benefit. My only concern with some of them, because people do it through, nasal ozone, rectal ozone, IV ozone, there's many ways people do it, is that some of the people that have done the IV ozone who've come to me, they burnt out their veins, right, from doing it. And, I'm, of course, looking, if possible, for the closest to a cure to knock down the load of the bugs. We've talked about it before with Dapsone that a lot of these people are going into long-term remission. And I don't know whether you said it earlier, I don't know if I've just knocked down the load where I've gotten rid of 99.9%. There's a few stragglers, your immune system's covering it. Or like in the mouse model from Monica Embers, we actually did eliminate the infection. I don't think we're going to have an answer. But for all intents and purposes, I try and do whatever is short and quick and the most effective. That's my only concern with the ozone is the people are doing the IV forms of it and that they're sometimes getting involved in this, that they may be damaging their veins. Have you seen this happen in some of your patients?
I can honestly tell you, I have never had a patient that has done IV ozone therapy.
Okay. All right. Yeah, because I've not done it personally, of course.
Yeah.
I've seen people come in with the side effects. And the thing about Rife, what's interesting about it, a good friend of mine, Holly Ahern, who we'll be talking with during the summit for Lyme and pregnancy. I know Holly has used these Rife machines. She said publicly her daughter has gotten sick. And there's a lot of these newer machines that are out there. And I have to tell you, it's tough keeping up because they keep changing these Rife coil, the different of the coil machines. And at least for me, it's a little bit difficult keeping up with it. I think like anything, because I'm a board certified internist, I like the hard science. When you can give me the hard scientific facts, it's best. And I know people are desperate, right? And they're doing a lot of these things. I don't know what these electromagnetic frequencies are doing to the body. In fact, we're all exposed to EMFs all day long. And you probably know, I don't know if you see it, but a small subset of my patients are EMF sensitive, right? Where, they're living near the power lines or stuff, and they do get sick. I don't see a lot of it, but I've seen it occasionally come up. And I just don't know the long-term side effect. I know some people, though, do report they get benefit. My bias, of course, has been that, if I can get them better with Dapsone and get them better with these short-term treatments, I don't have to use them. But you've not seen yourself all the years you've been doing this, the 17 years, you've not seen anything that would make you think danger at this point with using these pulsed therapies, nothing that's come up?
Tell me what you mean by pulse
Well,
therapy.
so in other words, some of these Rife machines where people are doing, because they are, in a sense, pulsed electromagnetic fields that some of
Yeah.
these people are
So
doing.
I have not, I have a lot of patients. So relatively speaking to like, like the IV ozone, I've seen literally nobody. As far as Rife, I would say I've probably had at least maybe, 60, 75 people who have done Rife as part of their protocol. It's not something we do out of my office. I have a colleague down in Guilford who does it, and that's all she specializes in. And I mean, people swear by it. I've never seen any harm come from it. And yes, I have had patients who are sensitive to electromagnetic radiation, but my understanding is that Rife and PEMF are very, very different. Like we cannot even though they're both radiations, so to speak, frequencies, right? There's no overlap in like the issues that they cause or how they work.
Great. So that's a good point for our listeners as far as your experience with that. Because again, I don't have as much experience. I'm just, I'm listening to stories from patients who come in and tell me my Rife machine is great. It's really worked. And I believe there's something going on. I just don't know at what point, what is placebo, what is real. I just wish the Office of Alternative Medicine of the NIH did exist at one point in time. I don't even know what they're doing these days. But honestly, it would be great to open up a branch for these chronic tick-borne infections. And, because you and I still always look at the hard science of what's there. And there's a lot of unknowns, of course, that we know. But yeah, I agree with you. People are coming in telling me they're feeling better. I just wish there was more long-term studies on some of these so we could just know for sure.
Yeah, no, I agree.
Yeah. And by the way, the far infrared sauna, I also have one. I have one in my basement. I think it's a great point to bring up, considering the hundreds to thousands of environmental toxins that we're all exposed to every day. I think it's a wonderful thing for people to do for the cardiovascular benefits. They show cognitive benefits. You're unloading the toxins. Your immune system has a nice boost from it. You talked about that earlier, and I would absolutely advise people. That is something I've talked to people about. In fact, early on in my medical career, I had 2 infrared saunas in our office temporarily. We were doing for people early on before we moved on because I didn't have anything else, right? This is the time we were giving like bicillin injections to people for Lyme before we knew about biofilms and persisters, and they were doing infrared. And definitely, I think it's a very useful therapy. And I think, again, with the environmental toxins, something that everybody should even be, talking about and thinking about as part of the prevention.
Yeah, absolutely.
Yeah. So anything else you want to add about, before we finish this up, about what not to do for Lyme disease? Any other advice you have for our listeners? And again, let them know how they can contact you if they want more information.
Sure. It's at taovitality.com, TAOVITALITY.com. And on Instagram, I am Dr. Mariah Hinchy. And I would say, like, the number one thing that you shouldn't do is give up hope. Okay. Like, we are teaching as many people as we possibly can. I am talking about vector-borne disease to anybody who will listen to me. There are constantly organizations that are trying to fund research and education, and just don't give up hope. Your mindset matters. And just because you haven't found somebody that can help you yet does not mean you're not going to. And hopefully, this summit alone is going to expose you to so many different medical providers that can help you. So don't give up hope.
No, it's a great point, and I'd like to echo that this issue. There are a lot of Lyme patients that are hopeless, and without being overly morbid, there are kids that suicide every year because they have given up hope. And I've known families where this has happened. Bob Bransfield, who's a psychiatrist who sees a lot of chronic Lyme and Bartonella, he also has seen this in populations. It is very important for people to know the reason that Mariah and I are co-hosting this and giving you all of this information is so you have hope, so you have the science, so you know everything that you can do to improve your health. And please do not give up hope, because from everything we've been talking about in this summit, from dapsone combination therapy to other persisters to biofilm to alternative complementary therapies. There's a lot you can do now. We have a lot more tools in our toolbox now, right, in the last couple of years than we had during the last 20, 30 years prior. So for all of you listening, please know there is hope. There's a lot of Lyme literate physicians out there who are following the kind of protocols that we're talking about during the summit. So I want to thank everyone again for listening and for attending the summit. Hopefully it will help you and your family to achieve better health. So we're signing off for today. I want to thank you again. Thank you, Mariah, for coming on as my co-host and doing this and talking about what not to do with Lyme disease. It's been a great pleasure working on this summit with you. And I wish everyone the best of health. And hopefully we'll see you soon at another one of these Healing Lyme summits. Thank you so much and stay tuned.